Welcome to this first session of the joint inquiry between the Health and Social Care Select Committees and the Education Select Committee on children and young people's mental health services. I'd like to start with a very brief introduction, if you don't mind. Dr. Alex George. Who are you and what do you do?
Sure, my name's Dr. Alex George. I served as UK Youth Mental Health Ambassador as a volunteer for 4 years. I stopped a year ago. I'm a campaigner and I educate a lot on mental health. My background in medicine is in A&E medicine, so I saw a lot of mental health on the front line, so yeah.
Thank you very much. Helen Hayes, please.
Thank you very much for being here with us today to give us your evidence. Could you start by telling members of both committees a little bit about your journey into mental health advocacy? I understand there are some hard parts to that story, and we'd be really interested to hear about it and to hear from your work what you think are the most pressing issues facing children and young people today in relation to their mental health.
Absolutely, and thank you so much for inviting me to give evidence today. So my background is that I basically studied medicine because I saw what A&E was kind of like on the front line. I was really interested in kind of dealing with emergency care. I liked the idea of science. I didn't really have a particular interest when I was younger in going into mental health. But when I started working as a junior doctor, I think the thing that shocked me the most wasn't necessarily the car accidents and so on. It was the sheer volume of mental illness you see in A&E. In fact, it was just utterly shocking. And not only the presentations we'd see, but the number of people who come back. And I quickly realised that there were so many young people that were coming in with, say, self-harm. I was patching up their wounds, getting them referred, and then they'd come back in a few weeks or months later. In fact, there's one girl I remember who I repeatedly would patch up her wounds. And as a human being, that is just utterly devastating to see. So I think that was my first realization that we clearly have a problem. I then started campaigning. In 2018, I first went to Downing Street to meet Theresa May, who was the PM at the time, and spoke about the changes that were needed in education, because I felt like that was a huge area that we could support young people. And then, as you kind of alluded to, during the pandemic, while I was working in A&E in Lewisham, unfortunately, my brother died by suicide. He was 19 at the time. He had a whole career, future ahead of him. He wanted to be a doctor. He had a place at Southampton Medical School, and yeah, he took his own life. And that was, my life has always been before and after that moment, and it's been pretty horrendous for my family. But we've tried to kind of use what has happened to prevent it happening to other people, because it's utterly devastating. And as my mum says, when you lose a young person or anyone to suicide, it's like dropping a pebble into a bucket of water. The ripples go far and wide, and the effect on everyone who's ever met is huge. So off the back of that, I started campaigning, gained huge traction on social media with some of the key things that people felt needed to change. The government at the time brought me in and said, look, let's look at some of these issues. Why don't we have you as a volunteer? You can sit between, so my role as mental health ambassador was to sit between kind of 10 Downing Street, sit with the Department of Education and Health, and also the charity sector and young people, to try and sit as a middle person. So there are many things that I kind of saw that were positive, but also things I think were quite challenging. One thing I'd like to acknowledge actually today is one of the biggest things I saw that was a real challenge for us was that different departments didn't really speak to each other enough. And I found that often you'd go to Department of Education and say, actually, this is actually a Department of Health issue.
We're going to come back and ask much more about that role, absolutely, in another question.
Yeah.
Throw it back to. Didn't want to stop you, but we absolutely are going to do that.
Thank you for telling us about how you got to be in this role, and I'm sure all of us would like to convey our condolences about what happened to your brother, and commend the way that you've been using that to make a difference for other young people. You've managed to establish an enormous reach amongst young people on social media. Can you tell us what are the things that they are telling you about what's affecting their mental health, what is driving this huge presentation across the population that we are seeing of children and young people exhibiting mental health difficulties?
Sure. I mean, there are so many factors that seem to be contributing to what's happening right now, and it's not just young people, it's parents. I hear from teachers. I did a talk the other day to around 600 people. Many of the audience was not just young people, parents, but also teachers as well. And clearly this issue is multifaceted. There are many compounding elements that come to cause what we're seeing today, and that's kind of what I'm saying about the kind of need for a cross-government approach to this. You know, yes, social media is definitely part of the challenges that we're seeing. Not just the harmful content, but actually the way that the algorithms are designed to keep you endlessly scrolling, for example. There's huge concerns the effect of that on the developing brain, the effect on that in causing kind of loneliness amongst young people who are not, say, outside and meeting friends and doing these kind of things. I think the social media is definitely a big part of the issue. But also I think young people are saying, actually, when they do want to get help, because actually they are much more emotionally literate than perhaps older generations, the waiting time for, say, early intervention, early support is incredibly long. And so what I heard literally the other day when I was speaking to parents and young people is that they're actually recognised by the teachers, for example, of having early emergent mental health issues often quite early, but the time between that issue and actually receiving the support they need can be very long, which means that allows a lot of time for issues to become very big. I mean, it's one of the main reasons that I worked for a long time on the Early Support Hubs initiative, which actually spoke to Prime Minister Keir Starmer just before the general election. I'd worked on that for a very long time because the point of those hubs is to sit there in the middle of the community to support people with emergent issues. And I think that is such a key problem, is that it's all very well people talking more about mental health, but when someone comes forward with struggles, they need to be seen and supported early. And I think that there's no doubt that the earlier you intervene, the quicker you can get people back into education or back, feeling well. But also economically, and this is a big thing we worked on with the hubs, it's a hell of a lot cheaper as well. It's really expensive to provide care at tertiary level, or in terms of seeing a psychiatrist. Community-based support is really important. So if I was to summarise, social media has a huge impact, definitely. The need for early intervention, but also the recognition of the challenges young people face. I mean, the report that's coming out about 1 million young people struggling to find work, one of the top cited concerns is around mental health and the challenges young people face in the working world. So a holistic view, I think, is desperately needed.
Can I, before I hand back to the chair, just ask two quick things. Firstly, are there any, you've talked a lot about social media as a driver of poor mental health amongst children and young people. Are there any other factors? We can think about poverty, we can think about pressures of other types that are bearing down on young people. Anything else you'd like to flag as a contributor to the scale of the crisis?
I mean, it's inarguable, really, the effect that a young person moves through many environments in their life. It's not just school, it's their home environment with their parents, it's out in the community as well, and obviously with their friends and so on. But it is absolutely clear that inequality and poverty is a huge driving force for mental health struggles. We see that. We also know as well that certain groups are at much higher risk. For example, those, I'm autistic with ADHD, those who are neurodivergent, are much more likely to have mental illness. So I think it's clear that we need to focus on have an overall strategy, but also recognise there are specific groups that struggle, as well as driving forces like, for example, poverty is a huge one.
Mm-hmm. Thank you. And then you've mentioned your involvement with early support hubs. The funding for early support hubs is by no means certain at the moment. What has the impact of that initiative been, and what would it mean if they were not to exist, or if support was to be delivered in a different way?
To be perfectly honest, when I came into the role, I kind of felt entirely overwhelmed because there's so much to do. And I had a very good bit of advice by someone in this area who said, focus on a key thing here, really target what you want to achieve. And for me, that was the support hubs. When I came into the role, the agreement was getting 90 million towards mental health support teams, which I achieved coming into the role. And I was calling for the national rollout, but my focus was on these hubs. So I was there since the start. And I've seen even hubs that have been run in charitable ways, the impact it has. It It is utterly unbelievable. It brings communities together. Young people have a place to go, not only just for support, but there is a sense of belonging. I think young people say, like, you don't have youth clubs anymore. There's not the playground, I guess, that you can kind of go to, and there's many reasons that has happened. But these hubs provide a real 360 for young people. And I guess I was very happy to see that the pilot hubs were funded. I was slightly disappointed to see we didn't go to national rollout, because I think our evidence and what we put forward was strong enough to actually go for national rollout. But to answer your question, I think it's so important. Like, we are desperate, and if you ask GPs, if you ask teachers and parents, we need to have a community-based support system. The mental health support teams in the schools that they're in, that I visited, are doing a great job. Obviously, CAMS is there to provide high-level need, but people are lost in the middle, and these hubs can provide that support. I genuinely believe that national rollout of those early support hubs would be a cost-effective strategy, but also one that would be hugely welcomed by young people, parents, teachers, and GPs.
Thank you. Thank you very much.
Thank you.
Manuela Pettingella.
Thank you, Chair. Reflecting upon the role of social media, you already mentioned some of the harms of this platform. So can you tell us a bit more about what role do you see platforms playing in both harming and perhaps supporting young people's mental health? And most importantly, what action would you like the government to take on these?
Social media, it's important to say, and I'm someone that, I educate through social media. I create content that goes out to millions of people. I've hundreds of millions of views across videos that I've talked about, spotting signs of people struggling, how to look after your mental health. There are many other creators, big and small, who really have positive impact. I mean, Ben West is probably worth a mention with his Reasons to Stay campaign, a wonderful person that in many ways we have a very parallel story. And I believe as of yesterday when we spoke, 3.5 million letters have been received by people who are looking for reasons to stay. So there are many reasons that social media is very good, but that doesn't mean you can ignore the harm that it can cause. So, you know, when you look at that sector, my big concerns are a few things. First of all, are we actually regulating what social media companies do? The online safety bill, which is something I was very supportive of, and I'm really pleased that that step has been taken, is really important. It looks a lot, I think, at content, but what about design? So how are these platforms designed? Are they allowing children to endlessly scroll, for example? Yes, they do. So I think a big part of our focus needs not just be about content, which is hugely important, but how are these designed? And I guess the question which comes up is, what do we do? I think part of it needs to be education at school. The education system was built, but the world is moving much faster than it evolves. AI, social media, all things that young people are now going to have to deal with. I think they need to be educated on how to use it safely. I mean, there's a lot of conversation about a ban at 16. The challenge is if you don't train people how to use it, you'll get to 16 and still have no idea. A lot of parents I literally spoke to the other week were saying it's really hard because I'm trying to support my child and I have no clue what half of these apps are, how to use them. You know, the education piece goes far and wide. But on the other side of it, we have to look, as I say, at the social media apps and consider that, yes, they play an important role. I think that there can be a positive impact, but we can't just allow like a almost free-for-all. There needs to be control, there needs to be responsibility, and these companies do need to take a look at themselves and think, actually, are we doing everything we can? Because I don't think they are.
Thank you very much. Jen Croft.
Thank you, Chair. And just to sort of follow up on that, just very, very briefly on social media, I think it's fairly obvious that these companies don't act in the best interest. I mean, just walking into work today, there are massive advertisements from YouTube saying about the controls that parents can put on them. Do you think overall it's like the benefits that can be gained from social media outweigh the risks, or do you think it's time for much kind of stricter regulation about who can access them?
I think the truth is that when you look at the number of people benefiting from social media, it's huge. And even for me personally, when I was diagnosed with ADHD and autism, the sense of community I had from those communities who feel like me, look like me, and experience what I've experienced has been, quite frankly, more important and helpful to me than any other healthcare that I've received, to be honest, because it's belonging. And there are many people who are marginalised who actually a lot of their connection comes through social media. So that's important to recognise. But fundamentally, for young people, the risk of harm, yes, through content, but also through addiction, through phones and the algorithms, is something you cannot ignore. I guess my concern of a ban, for example, would be how are we going to police that? Because in Australia, my understanding as we speak today is that there's been a huge challenge of enforcement. For example, there is a ban right now. Under 13-year-olds in this country are not allowed to use social media, and yet all parents, we all know that they're getting on there. And the question is, if they can't access that, will they go to darker parts of the web? So it's a very complex situation. My concern is that if we focus too much on just the ban without considering the role of the social media companies and putting pressure on them, will we just miss, do you know what I mean? We focus so hard on this that we forget to push them. That's my kind of concern. I don't think social media is going. It's a huge thing. It's a part of everyone's lives. So now it's a question of how do we manage it and, yes, police it to an extent.
Thank you. I just thought I'd follow up on that briefly at the start. My wider question is around, you kind of have a dual perspective on the issues around young people's mental health. What interventions have you seen that actually work in improving young people's mental health?
I have to say early support hubs, clearly. I believe in them wholeheartedly, and that had cross-coalition support, which is not always the case for interventions. Mental health support teams, not just from a data perspective in schools that they've been rolled out in, but also going to the schools themselves. I got to speak, I went with Will Quince actually, and we spoke, I went to many schools, but I went to one school where the teachers were saying, I cannot tell you the difference this has made, not just in the experience of the child, but in the experience in the classroom. Because when you look at, say, class behaviour, even class attendance, children that are struggling, that are unhappy, that are facing friction, that friction isn't just held within the child, it's spread across the classroom. And I actually have a person in my life who's a teacher, who's a primary school teacher, and we were literally speaking yesterday about this. And supporting the mental health of young people isn't just supporting their mental health, it's supporting teachers, it's supporting parents as well. Let's be frank, we are losing so many teachers. Look at newly qualified teachers in the first 5 years, the dropout rate is huge. That we can't ignore that. And one of the most common cited reasons is burnout and workload, and also managing classroom experience and behaviour. So mental health support teams are hugely important. I think the general thing that I saw over the years and what I've learned, I guess I have an interesting perspective because I don't see huge depth in everything. I've kind of got to see a little bit of a lot, which in itself is a useful perspective. Moving things upstream as much as possible seems to be the most effective way of supporting mental health, not just in terms of the individual, but economically as well. So as much as you can move to early intervention and even prevention-based approaches, it seems to really improve the outcomes. And I guess that's just sometimes stepping back and realising, are we actually preventing? And when there's a problem, are we intervening early? Because if we're not doing those two things, the problem's going to come back later. It's going to be, to finish.
What kind of interventions, really practical things work? Is it going into school? Are you looking at it more from a kind of raising well-being and mental overall good health kind of perspective? Or is there stuff around children that might have a underlying mental illness, early intervening on them? Or is it an across-the-piece sort of?
I think I'd go back to actually what was, I heard someone say the other day that if you look at the role of, say, for example, of a teacher, a teacher's role is very important in a young person's life, and we can easily get pulled in thinking about the exams and learning education. Even one good adult in a young person's life can provide stability and ability for that young person to grow and move through that system and develop into a healthy, resilient adult. And the pressure on, for example, teachers is so high, they're not able to spend time on that core relationship that they have with children. So I guess what I'm trying to say is that we need to make changes to create a school approach, for example, that is a whole school approach towards young people's health. So yes, that's educating on how to look after yourself. Finances, for example. People are often shocked when I say we should be teaching about financial health. What is one of the biggest causes of stress and anxiety in adults? Finances. I've gone around loads of universities, but also workplaces, and I say, hands up who left school here with a basic understanding of what a savings account is, what is inflation, what's interest rate. You know, for example, a topical thing at the moment, how many people in this room has gone to university actually understand how their student finance is funded? Like, what have you signed up to? Do you have any clue? And yet, that is obviously a big cause of stress in an adult. So we need to teach people about all of the things, directly and indirectly, that affect their health, and also provide an environment that is supportive of that. And yes, of course, that goes beyond the classroom. That goes into your housing and social care. That goes into your policy. That goes into supporting groups that are marginalised, for example. And that's why it isn't easy. I mean, the clear thing I learned over 4 or 5 years is it isn't easy what you have to do. But that doesn't mean we shouldn't take action. We have to pick our things and we have to go for it.
Thank you. And do you think the government does place sufficient priority on children and young people's mental health?
I think if you look at the allocation of funding, you'd have to argue no.
And why do you think that's the case?
I think that children can't shout as loud.
Yeah.
Children rely on adults to speak for them. So they are already one step removed from the people that are going to hear them. And that's partly, to be quite frank, that's why I did what I did, and that's why I do what I do, because I can shout quite loud. A 10-year-old in a classroom, actually even the young version of me, I really struggled at school. I was dragged out of class all the time. You know, I was told by one teacher in front of my parents, don't expect too much of Alex. And actually what was really going on is I was an autistic ADHD child that with the right support would have done well. The thing for me, and the reason I'm sat here today, is because my parents moved heaven and earth to make sure that I was able to get the education I deserved, and that I moved forward. And actually the second reason is I had an amazing teacher in secondary school. So I think it's recognising that, you know, that not everyone has that experience. We have to be a voice for young people and listen.
Do you think there's maybe a perception shift that needs to happen around the importance of mental health and mental well-being for young people to kind of shift the focus and the priority back onto it?
I think, you know, speaking quite frankly, I'm speaking in a room of people that clearly care about this issue. We're all here because we care about it, right? But I think that a lot of conversations that I heard when I was doing the work I did were not so positive, and it was kind of like, it's, you know, snowflake, it's all, I think, kind of slightly, people had a view that it was overhyped, and this is almost like making something of nothing. I mean, we've heard even recent comments about ADHD, which are infuriating. You know, and people still ask me, you know, are we overdiagnosing? Is it a bit of a fuss? You know, a Cambridge University study showed that a woman undiagnosed with ADHD and untreated, on average, lives 8.5 years a shorter life than a neurotypical woman. It's 6 years for men. There's actually a very interesting question about the disparity, by the way, between the two. But I think a lot of that was very frustrating at the time. I think we have shifted on, and that's why I feel that we're in a good position to act, because I think there is political will. The fact we sit with cross-party and cross-departmental conversations like this, we've got multiple different inquiries and evidence sessions into social media, into what we're doing here today. We are well placed to do something, but we do actually have to act. And I guess my concern is that this was done like 10 years ago, one of these inquiries, right? And not a huge amount was really achieved in that time. I think my hope and my plea, I guess, to all of you, is that we do need to act based on what we hear. Yeah. And that isn't easy. I think there's difficult decisions, and clearly, again, as I was told by Treasury and by Department, there's finite amount of money. But money that you spend on young people is very well spent, because they're your working adults. They're the people currently that are struggling, the million people that are not getting into the working world. And there is no area of life that won't benefit from a healthier group of young people.
On that issue, is there like one thing that you really wished you'd been able to change during your role as UK Young Mental Health Ambassador? Is there one thing that you kind of look back and think, oh, I wish I'd been able to make some progress on that?
I feel disappointed in myself that I didn't get. I really felt that I could get the hubs over the line, nationalised funding. And to be perfectly honest, you know, one of the most frustrating days in my whole, or weeks in my whole experience was I'd brought together a whole coalition. We'd gone into 10 Downing Street, we'd sat with Prime Minister Boris Johnson, and I'd been grilled about these hubs back and forth for a period of time, on that day including, and we left that meeting with a general feeling, the Prime Minister saying these hubs are a good idea, we should push forward. A week later he was gone. And then I got in touch with Number 10 saying, hey, about those hubs. And the kind of response was, what hubs? Because obviously, all right, civil servants stay, but there's a brand new team coming in. So it could be really hard. And I guess my concern, even as we speak, you know, we have a health secretary stepping down, a new one stepping in the middle of this process. And I think, there is no doubt in my mind that the way politics is broadly affects how fast things happen and what happens. Because, I remember in a period of 3 or 4 weeks, I think it was 3 different mental health ministers. Yeah. And that in itself is not great for a very complex issue.
So you need the political will and some stability
I think
behind
we need
it
to have,
drive it.
I understand the politics often runs by the electorate and like the topical things. But we have to have a longer term view. Yeah. I think that that we have to have a longer term view. We have to take action and commit to the action. So I wish I'd got the hubs done, and I wish I'd got that government to commit to the mental health support teams. I didn't achieve that. That was done after I came through. I hope some of the noise I made helped, but that was something that was really important. But I plead, as fast as we can to get that rolled out, because I think it's only halfway at the moment.
Thanks, that's been really helpful. Can I hand back to you?
Thank you. Darren Paffy, please.
Thank you, Chair. Dr. George, in terms of using social media as a mental health education platform and advocacy and so on, you're obviously grasping the opportunities and you have a clinical background, so we can have confidence in that. Do you see any risk that if young people start to see social media as the place they go in general for mental health support or advice and so on, that actually there might be others who don't have the clinical background that you do, who might sort of be well-meaning and well-intended, but it might become an alternative to clinical or therapeutic routes? Do you think there's any risk of that, and how do we mitigate for it if there is?
Yes, there is a risk, and I'm aware that just during the COVID times when I was in hospital saying, look, things are really bad here in Lewisham, seriously bad. Other people were trying to say, no, it's not a problem. So sometimes very noisy voices become very loud, and that is a challenge in itself. Misinformation online is a huge challenge, but the opposite is, staying silent and not contributing to that conversation is a mistake in itself. But I think it's so important that is not the primary, and certainly shouldn't be the only place that people get information. Part of, to be honest, and I've actually spoke about this recently, that I think part of what we need to do at school, particularly with AI, which is a separate, broader conversation, but also social media, is to give young people the skills of critical, analytical thinking. It doesn't need the same level perhaps as what we have to look at evidence, or I've had to do at medical school, but I think we should arm young people with the skills to question who is talking, what is their credentials, does this sound too good to be true, does this sound extreme, and if I'm in doubt, where do I check this? So, for example, I tell young people, if you see something online you're not sure about mental health, look on the Hub of Hope or go to YoungMinds and actually check what they're saying, and if in doubt, get information from your doctor. So giving children those skills is important, because ultimately you're not going to silence those voices. So yes, it's a concern, but I think the answer is probably equipping the skills to deal with it. Thank you.
Thank you very much. So Jen asked this, but I'll give you 2 more. If there were 3 things for this panel, this joint committee, to really push on, you said rolling out the early intervention hubs, you're allowed 2 more. What would they be?
Early support hubs obviously has to be number 1. And I guess, I'm saying this mindfully with the people that are coming after me, who I think will call for things that are very important. Please have and maintain a cross-government approach to this. It's so important. It genuinely was the biggest barrier to us getting stuff done. That has to happen. And third of all, I think it's approach this social media conversation with a really multifaceted approach. I don't think one approach on either direction is going to fix it all. We need education, we need some level of restriction, and we certainly need the social media companies to be answerable, I'm afraid.
Thank you very much for your time, Dr. Alex George. Thank you. Next panel, please. Thank you. Good morning, panel 2. We'll be looking at some policy. Can I start by asking you to very briefly, please, introduce yourselves and what you do? Can we start with Abigail Ampofo, please?
Good morning, I'm Abigail Ampofo and I'm Interim CEO for YoungMinds.
Good morning, I'm Jo Hutchinson. I'm from the Education Policy Institute and I lead our research on special educational needs and disabilities, also the overlap with mental health.
Thank you.
Good morning, I'm Connie Muttock. I'm the Head of Policy at the Centre for Young Lives. We're a think tank and delivery unit designed to improve outcomes for children and young people, and one of our key priorities is on improving their mental health.
Thank you very much. Josh Fenton-Glynn.
Thank you. I'm sorry to be speaking from so far away. It's the weird thing about this committee room. There's going to be a lot of discussion, I'm sure, in this about social media, but I just want to start by looking at the other drivers that aren't social media that impact young people's mental health. Our first witness mentioned poverty and neurodivergence, and also posit the kind of long lag of COVID as part of it. What do you guys think, and I'm going to start with Abigail and go along the panel, what do you guys think the main drivers of mental health problems in young people are that aren't social media?
Thank you. And Dr. Alex George did mention a range of things, and how the young people we work with describe it is that it's a million pressures that build up. So it is poverty, it is discrimination, it is racial injustice. There is a world environment which has been characterised by conflict for a very long time. It is concerns about climate change, it is school, it is the education system. And one thing which I remember a young person saying to me not so long ago, which really stuck with me, is that we just don't have hope. And I think that is a really difficult environment for a young person to be living in. The jobs market is more difficult. And I think this came out quite clearly in the Milburn Interim Review. The wider environment around young people has changed so much. So there are lots of things which keep building up and are contributing to young people's poor mental health.
If you don't mind me just quickly following up on that. So you said lack of hope and, you know, thinking about the job market and so forth. Is that for the older people, or is that throughout the piece? Is that from kind of quite young to up to kind of young adults?
No, I think the lack of hope is probably more coming through with the teenage years rather than the younger children.
Thank you. So it just gives us a more complete picture. Joe Hutchinson.
I agree with all of those factors. I think it is a perfect storm of many different things. Just to add a couple more to the mix, I think one thing that's very clear is the gender divide in the sharp increases in children with mental health difficulties over recent years. And we need to think about what factors surrounding girls and girls' experiences in society with boys, with other girls, right across the piece can be contributing to that. I think there's also been a broad erosion of children's services through years of austerity and focus on pandemic, having other priorities in government that mean that groups like children who are looked after, for example, who would have a very high expected risk of having mental health difficulties, we're not there making sure there are automatically services when it's very clear there's a high risk.
So just to follow up on that point, you talked about the gender divide. Is that a gender divide in kind of in raw numbers of people with mental health issues, or is that a gender divide in the types of and acuity of mental health issues?
It's both. So in raw numbers, the girls are higher, particularly in late adolescence. It really takes off, and you can see a clear pattern going into early adulthood as well, whereby if you look at the prevalence of, say, post-traumatic stress disorder in young people, clearly girls are on a rocketing trajectory compared with boys. And I think, you know, I can't prove what the cause of that is, but there are some very plausible potential causes of it around gendered violence. And then in terms of the types, it is more the case that girls are typically a little more vulnerable to depression and anxiety, whereas boys, it may be more likely that their difficulties have some behavioural aspects or are linked to neurodivergence. But in neither case is it true that you don't get boys who have depression and girls who have neurodivergence issues. It's just that the balance is different.
So just to nail that down, the rate of kind of potential kind of gendered violence and so forth from young men has led to a spike in the number of young women and girls suffering from post-traumatic stress. We think it seems.
We can't say that for certain, but the pattern, to my mind, I struggle to think of an alternative, plausible reason why, particularly through adolescence and early adulthood, things go very wrong for girls in particular. And I struggle to think of an alternative for why that might be, but I can't show you a research paper that says it is because of that.
Thank you, that's very powerful. Connie, just going back to the original question, kind of what are the key drivers beyond social media of the kind of increase in mental health problems among young people?
Yeah, I'd agree with everything that's just been said, and just add a couple of things to that. I think if we look at when children and young people's mental health starts to decline, we go back to the early 2010s, so around 2012, that's when their mental health starts to deteriorate, and we need to look at some of the patterns of what have been happening over that time. We talked about rising child poverty, rising inequality, lower living standards, but also the infrastructure of support that builds resilient young people and children, so our early intervention services like children's centres, youth clubs in particular. There was a 70% decline in investment in youth clubs in that period. We know they're really great for building young people's resilience, but also the patterns in how young people have been playing have changed. So we know that play is kind of fundamental to our development and to our well-being. Children play 50% less now than the previous generation. There's a range of contributing factors to that. And then I'd also just add the way that our education system has shifted in that time. So we've gone in that period of time towards an education system that prioritises attainment above all else. That relies on a high number of high-pressure exams that young people tell us make them feel very anxious, make them feel like that period of their lives is very high stakes, and make them worried about their future. And we heard also, I would echo the point around uncertainty. Young people describe an incredibly turbulent time, the huge disruption of the pandemic, but also the feeling of precarity in the geopolitical landscape, the worries they see their parents have about money, about the future, and the worries they have for themselves about their own futures create a feeling of anxiety. And I absolutely echo the point about girls and young women. I think we too often forget girls and young women in the discussion about children and young people. And particularly at that older age, you know, they experience almost double the rate of poor mental health as boys and young men in that 16 to 25 age group. So I'd really encourage the committees to look into that too.
Connie, because you're a think tank, I'm going to give you a slightly more policy-heavy question, just as a going back on that. So you're suggesting that kind of the result of austerity, meaning closing youth clubs and greater child poverty, has led to an increase in poor young people, children and young people's mental health. Would you then posit that actually the cost down the line will be kind of perhaps greater than some of the savings that government's made in that case?
Sorry, can you repeat the end of that
cost
question?
of the long-term mental health impact of that austerity? Do you think longer is going to have a bigger cost over people's lives?
Yeah, absolutely. We know it's far more expensive to strip back early intervention services to intervene later. I think there's a problem across our systems, but we see that especially in the mental health system, where we no longer have early intervention services, and it's a system that invests much later and is much more expensive. It's 100 times more expensive to treat a young person in inpatient settings than in the community. We know it's cost effective to invest in things like youth clubs, youth centres, early intervention support.
Just very quickly, I'm going to go to Abigail for my last question, which is, do you think that the government are going for the right things in terms of hitting these drivers of mental health in terms of their focus?
I think there are some green shoots of positivity. I think that there has been funding of some initiatives which is going to make a difference. So rolling out mental health support teams in schools is a good start. Early Futures Hubs, Young Futures Hubs, these are all really great starts. The announcement of a cross-government mental health strategy is really positive, and that's something which mental health charities have been calling on for years, and it's also a brilliant opportunity to really get under the cover and make some differences for young people's mental health. So if we think about the increased prevalence for young women and girls, for example, I think there is a credible argument that domestic and sexual violence could be a contributory factor. Now, that does take other government departments to respond to that. Being able to access employment, that takes other government departments. That can't all sit with the NHS, the education system and the pressure which that's calling for young people. So there's been some positive moves, but you've also got opportunities as government to really start shifting the dial and making a huge, huge difference, taking into account how different government compartments can work together to make change.
Thank you. I'm going to hand back to the Chair in the brief moment we've got a positive note.
Thank you. Caroline Bowden.
Thank you, Chair. So we are going to move on to social media now, and I'd just like to ask you all what behaviours are being observed in children as a result of prolonged and potentially addictive screen use, and how strong is the evidence linking these behaviours to a deterioration in mental health? So I'll start with Connie.
Thank you. Yeah, we're seriously concerned about what we're seeing in children and young people's behaviour with social media. We're looking at a generation of young people that are addicted to their phones, that are spending hours upon hours every day on their phones. Childhood has become more isolated, more lonely, and more time is spent indoors. And we're really worried that the impact of that will ripple through generations to come in terms of how that's shaping the minds of young people. I think we need a cultural shift in terms of how we approach social media. There is no other product that we would let be shipped out to young people in the way that it has been. We would not be letting anything that physically harmed young people to the extent that it harms their mental health be permitted to be in their phones, in their bedrooms all the time. In terms of the evidence, I think we have a challenge at the moment with a conversation around waiting for the evidence of the causal link between social media and children's mental health. There is evidence to suggest there is a clear pattern. Children who spend more time on their phones have worse mental health. That was clear in the Amy Orban review that the government commissioned. We also know that social media has significant impacts on things like children's sleep, and poor sleep has terrible impacts on our mental health and well-being. Children who spend more time on their phones have lower confidence, but it also catalyses a lot of the problems that we've heard described that are kind of broader. So if we think about girls and young women, sexual violence and harassment, that has skyrocketed in terms of their experiences of it on their phone. So it's also about the way that the unsafe content they're seeing is influencing their experiences. So we think we need to stop waiting for the evidence, and we need to take a precautionary approach, get children off their phones and place the onus on tech companies to prove they're safe rather than holding out for that causal link.
Thank you. Jo.
I think the strongest evidence is certainly that excessive time on social media or screen time in general is harmful, and I agree with Connie that is strongly linked to loss of sleep, and the fact that if a young person is using social media for 2, 3 or more hours a day, by the time they've been at school, they've slept, they've done their homework, they've eaten. There just isn't enough time for that to happen without it being when they should be either winding down for bed or already asleep. So the link with sleep is a very strong one in the evidence that we do have so far. I think there is a little nuance in that evidence, in that there does appear to be a sort of U-shaped relationship whereby the children with the very lowest risk of mental health difficulties are those who do use social media, but only for a short time per day. So maybe 30, perhaps 60 minutes at the top end of that. And then you see those who don't use it at all have a slightly higher risk than those, and those who use it a lot, getting sort of 2 hours and upwards, have the highest risk of all.
Okay, thank you. Abigail.
Yeah, I'd like to start this response by what a young person directly told us. I think as someone who was thrown out of education because of my health issues and had a period of time when I was completely housebound, I didn't leave the house for months on end because my health was that bad. Social media at that time, for me, was an anchor. Because I stayed connected with people online, without that, I wouldn't have any connection at all. But I think part of the issue with it being so much of an anchor was that I was more impressionable, because I kind of clung to whatever content I could because it was all I had. And so I was a lot more glued to social media than perhaps I should have been, but there was no alternative, I guess. And I share that quote with you because the young people who we work with have told us quite clearly that for them, the online space does bring a sense of community, and it brings a sense of community at a time where other spaces for young people have disappeared. But equally, they're also cognizant to the risks, the concerns, the worries of social media that I think we all are. So for YoungMinds and what we've heard for young people, our focus really is putting the responsibilities back onto the tech companies and start making sure that we always think of safety by design. And I go back to this cross-government strategy in mental health. You know, it is a cross-government response and another opportunity to take into account something that does cause harm to young people if it is not delivered properly.
Thank you. And just a very quick follow-up just to Jo. You've talked about girls and young women, but have you seen any evidence that shows whether other groups of children are more likely to experience negative or positive mental health effects from social media? Are there any particular groups that stand out?
In terms of a link with social media, I don't think the evidence is that detailed yet. There are certainly lots of groups, other groups beside girls, who are more highly vulnerable to mental health difficulties in general.
We've heard that disadvantaged children might be more at risk of grooming or effects like that from being on their phones. Is that something that you've come across?
So not in the sort of not in the journal-based evidence that I'm focusing on, but it's important to recognise that the testimony of young people and what they are saying to charities, to other people involved in the young people's mental health space is evidence. It's just a different kind of evidence.
Thank you.
Manuela Pettingell.
Thank you, Chair. My question is for Connie Muttock. So the Centre for Young Lives is amongst many who have called for a regulatory framework for social media, including minimum age requirements for harmful social media platforms, also stronger safety by design, duty of care obligations for tech companies, and also, and most importantly actually, to take a public health approach to social media harms. So I want to ask you, what does a public health approach to social media, but also probably gaming platforms, hybrid spaces, AI chatbots, we're reading lots of evidence about these as well, the harms of AI chatbots, and messaging apps as well. What does that look like? And over what timeline would you like to see the government take action?
Thank you. So by a public health approach or a precautionary approach, we mean that we think we need to get children and young people off social media with immediate effect. We know, we can see the really significant harms that are playing out on children and young people's phones and in their lives, and we don't think that we should be waiting for anything, for tech companies to do anything before we make that happen. We think that in any other industry, we would not let a product out into the world until it was proven that it was safe for children, and that's the approach we should take to social media. I'd count within that AI. We do really need to take a close look at the experiences that children are facing on chatbots. Increasingly, children are turning to AI for mental health support, and that is seriously concerning. Those are environments that are designed to only positively reinforce what they're saying and do not have the mechanisms in place to get young people to urgent help. So we think children should be taken off those tech companies, off those platforms as soon as possible. The onus should be placed on those platforms to help children, to help make them safe before they're allowed back into the hands of children. But also we need to look at the alternatives. So we know that the grip of social media in children's lives has increased just at the time as the alternatives for them outdoors in real life have been pared back. If you look at the pandemic, children's social media use skyrocketed just at the time when they had nothing else to do. I think we have a boredom problem for young people today, for teenagers today. So we also, as part of that public health approach, need to be investing in play, in youth spaces and in those offline alternatives to help young people have more enriching things to do in their lives than doom scroll.
Thank you. And following from this alternative offer, are you calling as well for safer online alternatives? And if so, what does this alternative online offer look like in practice, and how can be delivered?
Yeah, absolutely. I think we should really be listening to the fact that so many teenagers are turning to ChatGPT for mental health help. That tells us, A, that our systems are fundamentally failing them. They are more likely to get help from AI than they are from a medical professional, which should seriously concern us. But it also tells us about the type of support that young people prefer. Young people do tell us that AI can be a good pathway for them in the sense that it's more accessible, in the sense that it is more immediate and it is stigma-free. So we do think that we should be creating safe platforms for young people, but we cannot do that while our wider system of mental health support is fundamentally failing to meet need. You can't have an AI platform refer a young person onto further support if that support doesn't exist, if we've got a 55% treatment gap.
Thank you very much. Greg Stafford.
Thank you very much. And I just want to continue on that line of questioning just for a moment. So, Ms. Ampofo, the committee has heard some evidence that actually social media can fill a gap in young people's sense of community as well as learning, creativity and entertainment. Do you find that argument convincing?
Yes, because I'm hearing it directly from young people. So yes, I do find it convincing. Yeah, I think if we go back to some of the things that Connie is saying, I think it's absolutely right. You know, young people today have grown up in the digital world, so this is not new to them, this is their reality. So I don't think it's a case of, you know, yes, no, the fact is it's here and they're in it. So we have to be more intentional about how we do some of our work. And what AI could do is give us the opportunity to actually reimagine and redesign whole pathways. But that does require that intentionality aspect of it. Otherwise, the harmful aspects will still be there and will not be addressed.
And as Ms. Muttock just talked about, provision that is offline, do you believe that if the offline provision were better or more extensive, then children would start to come offline? Or do you think we've crossed the Rubicon now? We've gone too far and online is now the way to go?
I don't think I'd necessarily look at it that way. Provision has to be better, and we have an opportunity to design provision in a way that meets the needs of different groups of young people, and in some cases that face-to-face provision really embedded in communities is the right way. For other people, being able to access provision through an online space, still maintaining that relational approach, is the right way. So it's about how do we design the pathways correct. I don't think the focus is so much whether it's offline or online, but the pathway as a total.
Okay, and you use the word we should. Who is we? Are we talking about government intervention here, or is it down to local authorities, schools, the NHS? Who is the we in this situation?
Everyone you've mentioned is the way. You are absolutely correct. Everybody is the way.
Could you give me some practical examples, therefore, from a government? What could government do that would improve the situation?
Funding. Government to provide funding. We think about what strategies, and I go back, I think I'm a bit of a broken record with this cross-government mental health strategy, but then we can think about what legislation also looks like for local authorities, for schools, for youth clubs. So I think that there's a range of ways that lots of different departments can do this.
And is there one or two things that I don't know, schools or the NHS or other public bodies that interact with young people could be doing offline, in the offline space, that would make a real difference, do you think?
Yeah, so maybe we just start with education for one of them. What young people and their parents have told us consistently is that the education system as it stands at the moment is one of those million pressures. Opportunities for looking at how assessment is delivered for children. Those stats cause a huge amount of pressure for young people. Are stats measuring children's attainment? Are they measuring school attainment? Do we need to have stats? Having everything based on high stakes exams where young people are saying actually they're not even getting us ready for the world of work, but it's creating so much pressure building up to them. There's ways to reimagine that. Taking a whole school approach to mental health. So mental health support teams in schools are absolutely brilliant for the support they can give young people, but that's not going to make a difference if the rest of the school system isn't focused on young people's mental health and well-being. So for example, behaviour policies, how teachers respond when a child is struggling.
Very helpful, thank you.
Thank you very much. Peter Swallow, please.
Thank you very much. Connie, just on that theme, I wonder if I can get your view. It feels that we've got a really ambitious national youth strategy, which speaks to some of the ambitions about getting more support in the real world for our young people, and there's obviously a very live and energetic conversation around social media. I'm not always convinced that we're necessarily linking the two together well enough. So what is your perspective about sort of some of the real world offline spaces that need to be created if we are to support young people to access support for their mental health in settings that are more regulated and less sort of Wild West than some of the spaces we're seeing on social media?
Yeah, so I think it's fair to say we haven't talked about children and young people's experiences of those mental health services yet, but we have a system that is fundamentally failing young people. It is failing them across the board, from that kind of early intervention stage through to the way that crisis and specialist care is working. Record high referrals, we have incredibly long waits that children are facing, parents and families are at the end of their tether. So the system is completely failing when we look at that real life in-person regulated mental health, high quality mental health support. We think we need to see two things shift really: prioritisation and reform within that system. So we need to prioritise children and young people's mental health much more within our health systems, and perhaps we can come on to a conversation about where we spend money, how targets shape the decisions that are made by the NHS. But we also need to see reform. We are really strong believers at the Centre for Young Lives in early intervention and prevention. So we need to see a shift. It's really welcome to see the plans in the 10-year plan for a shift towards community interventions. We need much more of a focus on what that looks like for children and young people. Things like early support hubs, which were mentioned by Alex George earlier, mental health support teams, both expanding that provision but also making sure it can meet a higher level of need, and bringing some of that specialist mental health support to our youth spaces. We know that in youth centres, for example, youth workers say they are dealing with really high levels of need and they don't know what to do and they don't have the capacity to deal with it. So we need to bring those professionals into the community where those young people are, but fundamentally we need to prioritise children's mental health so we have the capacity to do that.
Thank you. Joe, the Fonagy interim report suggests that there's a much more complex picture than simply under or over diagnosis, particularly with neurodiversity. Do you agree with this assessment, and what evidence do we have to support that view?
Yes, I do. I do think it's more complex, and the thing that really struck me in the interim report from the Fonagy review was that you can very clearly see an increase in distress in young people. And to me, that makes it not plausible when some people try to make an argument that young people are simply need to toughen up in some sense. It's quite clear that the symptoms are more severe for young people, and we definitely know on the depression and anxiety side that the more severe the symptoms are and the distress is, then the more impaired those young people will be in terms of being able to go to school, benefit from education, move into the world of work, etc., and socialise with their friends. So for me, that was a really key point. And I also think that there is something to explore further in the point that was highlighted about how the structure of services and systems can itself generate more need in young people. And it links back to what Connie was saying about early intervention, and the fact that it is so much more difficult to treat mental health difficulties the longer they have been left to fester, and the young person has been left to come up with their own means of coping, which may not have been ideal, but they were all they had available. So I think it's really important that we do take steps to tackle the capacity issues in CAMS, the fact that there is that gap in the middle of the range of severity with children with moderately severe needs, not many services at all, and then looking at the more preventative picture and the mental health in schools, teams, and that sort of level, the non-clinical, non-specialist type services. What the evidence is telling us is that that's still very patchy. It varies from location to location, and there's no guarantee that any particular young person is going to be able to access it.
And that brings me on to my next point, and this is something that is highlighted in the review, but it's also something that every MP around this table will be really familiar with from our own constituency casework, and that's the way that increasingly diagnosis is becoming a gateway for support rather than something that happens along the pathway of support being delivered. I'm sure we have all experienced constituents telling us how difficult it has been to access an EHCP assessment if they don't already have that diagnosis, despite the legal framework not having that as a requirement. And I don't want to tread into confusing neurodiversity with mental health, but there is obviously a connection. So from your experience and the work that you've done, what do you think needs to be done in order to sort of break that link and get genuine early intervention back in place that isn't reliant and waiting for a diagnosis to get the support in place?
So there's a couple of things. One is I think we need to really make sure that we are properly resourcing and ensuring sufficient workforce capacity for new services like the experts and at hand service that's planned through the school's white paper. That will not deliver on its extremely laudable and suitable intentions if we continue to have big shortages of educational psychologists and the other professionals that are actually needed in those services. The other things that we can do, I think, thinking about schools more generally and the education system, it's pretty clear that the current curriculum and set of assessments that we have nationally is so focused on academic achievement that it's squeezed out the space, particularly in primary school, which is needed for children's broader development, their social development, that actually takes place a good deal through play, through art and music, through storytelling, those kinds of activities that can get squeezed out if you're on a conveyor belt of assessments, and also particularly if some of those assessments may not be appropriate for the full population of children or set at the wrong age for children and their development. So I think that's an important preventative aspect that we could look at. yeah, those. I could go on, but
and I think that provides a really helpful segue to talk about the Milburn Interim report as well, which highlighted some of the challenges that you've just picked up on there. Both the Fonagy review and the Milburn review highlight a significant increase in young people who are not in education, employment or training due to mental health conditions. And I think probably the flip side is also true, that being neat is likely to increase the challenges with one's mental health. Abigail, what are the young people who you work with telling you about this connection between feeling that there is not enough opportunity for employment, education and training, and their mental health? You already said very powerfully, talked about a million pressures. Is this exactly conflating some of those pressures?
So we deliver a helpline for parents and carers, and around 11% of our calls are from parents who the young person in their life is not able to go to school, and that's usually due to their mental health and not being able to get the support that they need to access for that child to go back into school. And that's probably increased quite considerably since the pandemic. So before then, far less of our calls were around children and young people not going to school. When we talk directly to the young people, school is a big source of stress and pressure for them, negatively impacting on their mental health. I think I spoke before about the exam system and how that builds up to a huge pressure which results in children avoiding school. So I think what we're hearing and you're saying is that they're starting to become this vicious circle, that if children aren't able to access school and an education system which is equipping them for the future, and then we've got huge amounts of young people not in education, employment and training, that bit in school is the part that we have to crack to be able to address later on.
Very, very briefly, do either Joe or Connie want to add something to that very briefly?
Yeah, briefly, I would just say the point you made about the bi-directional impact of being out of employment, education and training is really key. So we know that children that young people who are NEET now are much more likely to have poor mental health, but also the longer they stay out of work, the worse their outcomes are likely to be. So that's a really significant problem. And we know there are interventions that work. So IPS, the Individual Placement Support Programme, has really strong results. It pays for itself and then some.
I think my colleague Jess is possibly about to come on to intervention, so I'll pass back to the chair.
Thank you very much. Jess Sutton.
Thank you so much. So as we do look forward to those final reports from Fonagy and Melbourne, what would be the key concrete policy that you'd be expecting to see from those reports to address the drivers of poor mental health? And I will start with you, Connie.
Yeah, I'm actually going to zoom out and not talk about interventions for the priority really for this here, because I think it is about prioritisation. So I think particularly from the Fonagy report, which will talk about the prevalence of poor mental health and obviously the drivers of those challenges, the problem we've seen here is that we have actually known about these issues for some time. This committee met 9 years ago, almost a decade ago. Our founder appeared before these two committees to talk about children's mental health. It's taken until now to get a review of the prevalence of children's mental health problems. What we need to see is some really tangible shifts to respond to that. So we want to see shifts in what we spend on children's mental health. We spend less than 1% on children's mental health across the NHS. Mental health more broadly gets only 10% despite making up 20% of the overall disease burden. So it's about a shift in how we prioritise. It's about targets. We know the health system responds to targets. It's an absolute crying shame that we have really strong targets for elective health and nothing for children's mental health, that we're prioritising bunions over children with serious mental health problems. but also it's about how that system shifts. So the Fonagy review in particular is looking at the drivers and also the system response, that the system intervening later is exacerbating need and making interventions less effective, because the more you wait to respond, the less effective that intervention is. So we also need a response to those two reviews, which looks at a truly cross-departmental strategy. I don't want to see a strategy where each government department repeats the things that they're already doing. We need a strategy where each government department takes responsibility for this generation of young people. Department for Work and Pensions, DSIT, Department for Education, and Department for Health and Social Care and beyond, each taking responsibility for this generation, each investing, and each making sure that they have shared accountability to really shift the dial.
Jo, Abigail, do you have anything to add to your expectations for the outcomes?
What I would like to see happen as a result of the final stage of the Fonagy review is I would like to see that work joined up with the work that's going on to develop the school's white paper priorities around special educational needs and disabilities. And I would like to see there being some funding from government for shared professional building between education professionals, mental health professionals for children and young people, to actually sit down and discuss alongside all of that evidence, how do we create new systems that don't have gaps between them and holes in them and don't result in us all just pushing children backwards and forwards from one service to another. I would like to see that being a collective professional endeavour, but that's probably not that likely to happen unless there's a sort of structure and funding for it to take place.
Again?
I completely concur with what Connie and Jo have said. Definitely around the funding, the accountability, the no wrong front door for children and young people. And then probably the last thing I'd like to see differently is how we talk about children and young people related to their mental health.
Yeah.
No, we're not talking about NEETS as an acronym, we're talking about children and young people who are not in education, employment and training, and we shift our language to very positive about children and young people with mental health needs.
Thank you very much. Mark Seward.
Thank you very much, Chair. I'm going to ask you a couple of questions about widening access to mental health support services for young people. Connie, I'm going to start with you. The Centre for Young Lives has stated that the threshold for accessing mental health services has risen, and this has created a missing middle of young people who don't access services until they're at crisis point. How well is the government addressing this missing middle?
Yeah, this missing middle we talk about, it's worth saying that we fail on all fronts, firstly. So we fail on the early intervention, we fail at specialists and crisis care. There are problems across the system, but there is clearly a problem for this missing middle of children and young people who were told they are too high need for those early intervention services and not high need enough to meet the threshold for CAMS. I think that's because our systems are highly overburdened, because they're having to rely on very high thresholds because of the very scale of children that are coming forward for their support and their inability to respond. To take an example of mental health support teams, we're seeing examples, that's an intervention, a really welcome intervention. There are really positive, ambitious plans to scale that up, but it is for mild to moderate needs. We're hearing examples across the country of young people that are being told that they are too complex for those mental health support teams, but that are then seeking a CAMS referral and being turned away. Around a third of CAMS referrals are closed, so we need to be looking into the experiences of those young people. What's happening to them? What alternatives are they being offered? The answer is very little, and that leaves children and families really at their wits' end with nowhere to turn. So we do need to really look at that missing middle. There are interventions that we know work. So the previous evidence session talked about the early support hubs. We really need to see commitment from the government to make sure that there is meaningful mental health support in hubs across the country. We really welcome the Young Futures programme. It's a programme that we recommended as part of the Commission on Young Lives. We've been working with the government on that programme. We really want to see a robust mental health offer within that. It cannot just be a wellbeing offer, otherwise we will have the same problem of young people being referred on, and the waiting lists just expanding. So we need to meet that middle need meaningfully in the community. And crucially, no child should even know that they are too high or too low for this service or that service. They should be oblivious to it, and it should be the responsibility of the health system and the education system jointly to find a place for that young person and the right support.
Okay, so do you think the government's doing enough?
I don't know. I don't think we're doing enough across the piece. I don't think the government is doing enough across the board, but this is clearly a gap. We did see the extension, a really welcome extension of the funding for early support hubs. So those 24 hubs, we saw 7 million extended for a further year. That's just 1 year. So services that are thinking about how to hire staff, how to offer support in the longer term. We really want to see the extension of that support, but also the expansion of it. This government talked about mental health support, universal open access mental health support in every community. We need to see that become a reality.
Okay, thank you very much. Joe, the EPI has found substantial variation across the country in the range of mental health support services that are delivered outside of the NHS. And I'd also say, Abigail, YoungMinds has argued that the persistent gaps in provision are exacerbated by the lack of community-based services. So what should the policy response be to this? I'll start with Joe, if that's okay.
I think part of the reason we're seeing such a patchy, uneven picture in those non-NHS services is precisely because they are non-NHS services and are often delivered on a voluntary basis by charities, by organisations that live from one small grant to the next and rely on their local authority still having a budget available the following year. So I think seeing those, having that category of early intervention being outside of the system that is planned and funded centrally, it's sort of inevitable that we end up with patchiness and inconsistency.
And how would you address it?
So I think what we need is, again, it is cross-government, but we need a plan that is going to cover all levels of intervention. So it needs to be looking at what is happening in the link between CAMHS and schools. There are issues there around consent being a barrier to information sharing. The end result of that is schools get less advice from clinicians about what they could be doing in school that would support the young person and how their mental health needs may actually be impacting on very educational factors, things like memory, attention, concentration, motivation, things that should be the bread and butter of schools. But if they're not receiving that information and that advice because it's too complicated or time consuming to get consent from the young person to share information, then that's going to weaken the middle out of things. And I think we basically need to look at the whole picture and plan a tiered support system that is governed through the same overall budget and accountability structure, even though it's complex because it's not just one department.
Yeah, okay, that's a helpful answer. And Abigail, how should we address this variation?
Yeah, I mean, I think my Connie and Joe have given really, really good responses to this. But you know, one of the things that young people do tell us consistently is they feel that they're going through wrong doors. And I think we have to get to a point where there is no wrong front door for young people to access to get the support that they need. And I think the only way that you achieve that is if there is one overall coherent plan that everybody is following and delivering, whether you are a clinical service, whether you are a housing service, whether you are an education service, social care, ad infinitum. But there has to be that one overarching, really cohesive plan.
Okay, thank you. And then just one final question from me in the short time that I have left. This is for all of you, starting with Connie, working across. How should success be measured, and what would meaningful progress look like over the next 3 to 5 years in addressing this missing middle and the variation in services across the country?
So I think we need to measure two things. We need to measure our ability to meet need, and we need to measure our ability to bring down prevalence, both in terms of the numbers of young people that have mental health needs, but also the scale of that mental health need and how it's shaping their lives. You know, Is it reducing their absence from school as need reduces? Is it reducing the NEET rate? So we need to measure ourselves both on how we're being able to meet that level of need in the community, but fundamentally, are we shifting things in the lives of children and families, and are we making sure that they're able to live kind of happy, fulfilling childhood that they should be doing?
Thank you.
I think the NHS has had a tendency to measure its performance in terms of the number of children that are now being seen within its services, without reference to how many children there are who need to be seen, and therefore they can be going forwards in their measurement while actually we're going backwards in the chances of a single child actually getting the help they need, because the number being seen and the proportion being seen are two different questions mathematically. So I think that's important. The other thing I would add to what Connie said is that I think we need to be looking at using the longitudinal educational outcomes data and other government data sets to be looking at what are the long-term outcomes for young people, things like whether they are becoming NEET or struggling to join the workforce, what is their long-term health picture looking like over time, because ultimately we care about children's mental health in its own right, but also because of the implications it will have for their adult life. So I think we need to be looking at their educational, employment and health outcomes across their 20s and up to at least age 30 to be seeing, is what we're doing happening is one question, but is it working is a second.
Okay, thank you very much. Abigail.
And I think just two things I would add to that. The first one is the proportion of children receiving the help within their community rather than in hospital care, and young people's experiences of services. We should be co-designing services with children and young people. How well do they think their views have been taken into account with the service design?
Thank you all for your answers. Please, Connie.
Can I just add to that, sorry, that I think we need targets not just for the health system, but for the wider system more broadly. So we should be measuring schools on children and young people's wellbeing. There was a really lively debate in Parliament on a national wellbeing measure, which we still really want to see. I think the cross-departmental strategy is an opportunity to make that a reality. We need targets that are placed on health in the same way we have targets for elective care and other priorities within health. But we also need targets on the Department for Education, schools and the wider community to shift the dial and to make sure that responsibility is shared.
Very helpful. Thank you all.
I'm sorry,
Thank
but I'm just going to add one more point as well, and helpfully. I think we also need to be measuring inequality, so black and racially minoritised children and young people, are they also able to access support and services at the same rate as their peers?
Thank you. Joe Robertson.
Thank you. Turning now to the modern service frameworks, I think there are two we're expecting that are relevant to what we're talking about today. That for children and young people, but also the MSF for severe mental illness. What should they contain in order to lead to meaningful improvements in widening access to support? Happy for any of you to start, but I'd like to hear from all of you if I could.
Yeah, happy to start and then I'll come in. So yeah, we really welcome modern service frameworks, particularly for children, but also for serious mental illness. There's an opportunity here to build some consistency, but we really, in particular, our priority for the children's modern service framework is for it to set some clear direction on that shift from intervention at a late stage towards intervention in the community. We know that there is less confidence among commissioners, among professionals, about how to deliver that support correctly in an evidence-based way, in a safe way to children and young people in particular. We see that play out in the kind of social prescribing and the number of children's link workers there are there. We see that playing out in the extent to which ICBs commission community-based services for children and young people. So the modern service framework is an opportunity for greater consistency, higher standards, and particularly a stronger emphasis on bringing that support into the community where children are. And the only other thing I would add to that is that we really want to see that framework listen to children and young people about what they want from services, but also set clear direction about how local services can do the same.
Thank you. And we might expect children and young people, very obviously, their voices to be fed into that MSF. But presumably you would call for that into the Modern Service Framework for severe mental illness as well.
Yeah, absolutely. I mean, across the board, too often we treat children's mental health as a second priority, or children's health more broadly in all of our measures of success across the health system. It's why we see them get less funding. It's why we see less good outcomes for children in terms of their experiences within the health system. For the serious mental illness modern service framework, we really want to see the dial shifted, particularly on children's experiences of crisis and specialist care, the use of out-of-area placements, the use of restraint in these services. We want to see stronger standards for children with serious mental illness in those as well.
I think there's a couple of blind spots that I would point out. So one relating to the children's framework is around the fact we do have gaps in services to respond to children who've experienced trauma. And that is something that children are, in a sense, uniquely more vulnerable to than adults, because they have very little control over the circumstances they live in at home, in the community, etc. So I think addressing that within the children's framework would be useful. And I think in terms of severe mental illness, it's also important to recognise that some forms of severe mental illness are not diagnosed in children because it's simply seen as too soon to diagnose them. So they may be displaying symptoms that are indicative that they may end up having a severe mental illness as an adult, but not getting a diagnosis that might count against a list of conditions that are severe mental illness. So it's important that we take into account that the diagnosis doesn't work quite the same way, and therefore children may be less seen with severe mental illness than adults.
And finally, I don't know, Abigail, whether there's anything you wanted to add to that.
The only thing I would add to it, both for children and young people and serious mental illness, is the disparity, the inequity, and how we can make sure that black and racially minoritized people are taken into account, and that's a focus.
And if I could also ask, how could the forthcoming mental health strategy meaningfully deliver the shift towards prevention, where intervention is needed, early intervention, and community-based services set out in proposals such as the Future Minds roadmap? Trying to look at the how here.
Yeah. So I think it's partly about the interventions that we prioritise. So we've talked about mental health support teams, early support hubs, but also harnessing the opportunity we have with the youth strategy to get mental health support into those community services. I think the MSF is important there because it helps drive consistency in those services, but the strategy itself, it's also about bringing together those departments and thinking about how can each of the different reforms that are coming through, the special educational needs reforms, the youth strategy, the DSIT reforms, how can they all be working towards promoting children and young people's mental health. But to zoom out a little bit, I also think when we talk about prevention, there's a real opportunity here for a bit of a cultural shift and a conversation about how we can build the foundations of good health. What does good mental health look like, or what does building the foundations of good mental health look like when we think about a child and their experience? We think about children growing up in a home where there's domestic abuse, where their parents might have poor mental health, or where there's substance misuse. We think about a child that is experiencing, is at risk of exploitation in their community, a child growing up in poverty. We've heard at the beginning of this conversation about the drivers of mental health. I think the strategy is an opportunity to build the foundations on the flip side of that of good mental health, starting with those drivers, but then also, as I said earlier, looking at how we can expand those early intervention services, and that is also about how you shift and prioritise within the system. We talk to local commissioners all the time and they say, there is money in the system, it's about how you prioritise it, and we know it's much cheaper to invest in those earlier intervention services.
Yeah, unless there are any other comments, I'll hand back to the chair. But thank you.
Thank you very much. Well, we've got 2 minutes left before we have the Children's Commissioner in front of us. I'm going to ask each of you to pick one thing that you are keen to leave with us as the most important thing that we push on in this report. Can I start with you, Connie, please?
I think the single thing that this committee could look at is what has happened over the last 10 years and what we need to do differently next. So I mentioned at the top of this discussion that we have had strategies and plans that have recognised children's mental health, and in the years since, their mental health has got worse and our ability to meet their need has got worse. So we need a conversation about why that hasn't shifted the dial, and therefore what can the government do next. And I think that's about prioritisation, it's about spending, it's about movement towards supporting the community.
Thank you very much. Jo?
I think we need a really clear focus on harm prevention for children, whether that's through child protection, whether that's thinking about the education system and the curriculum and assessments and all aspects of children's lives, and perhaps some sort of an audit using clinical records of actually working out what are all the touch points where children are experiencing harm would be really useful in developing a good strategy for prevention.
Thank you. And Abigail?
If we are at 1 in 5 children and young people with a probable mental health condition now, up from 1 in 9 back in 2017, then I think as a country we have to ask ourselves seriously, where do we want to be in 10 years and set that as our benchmark.
Thank you very much, all three of you. Much appreciated. Thank you. Please, can we have the next panel?
If Joe goes, we've lost chorusy.
Oh, wait.
Joe? Right. Oh, Andrew's here.
He's okay. We'll still core it. Right, lovely. Thank you very much for being here. May I ask you to very briefly introduce yourselves and what the Children Commissioner does, please?
So I'm the Children's Commissioner for England, Rachel de Souza. I've been the Children's Commissioner since 2021. I started just as COVID restrictions were lifted, and I protect and promote the rights of children. One of the key things that I do, I think, in this house is bring the voices of children and their experiences, but I also have a really fantastic research team. I have got data powers, so I've got lots of data for you today that I'm able to get hold of on mental health as well. So we use data as well as bringing the voice.
I'm a huge fan of data. Helen Hayes, please.
Thank you very much, Chair, and welcome, Dame Rachel. Thank you for being with us this morning. Can I start by asking, you're coming to the end of your 6-year term as Children's Commissioner now, and there have been significant changes over that time. Can you provide some brief comment to us on how the drivers of children's wellbeing have changed in recent years? What are the trends that you've seen in your 6 years as Children's Commissioner?
Yeah, that's really interesting, and the best way for me to do that is to tell you what children have told me themselves. So when I came into role in 21, I went out and did a major survey. In fact, we got the biggest survey response in the world to the Big Ask, and we asked children coming out of COVID, how are you, what are your vulnerabilities, what do you need to thrive, what do you want for your future? What's interesting is back then that 500,000 children talked to me about their mental health as an absolute top priority. They wanted to get back to school. We had all those huge worries about school absence at that point. And they talked a lot about, back then they were very ambitious, they wanted great jobs, and they wanted school to support them, to help them. And that was very much the picture, and that was children in every part of this country. And there were some really, really vulnerable children, and there were some real vulnerabilities it was that time of explosion when everyone was talking about mental health. Very interesting, 6 years on. I'm out now in my final year doing my big future survey. We're hoping to hear from 1 million children this time, so I'm sure we'll be up in your area. I started up at Hadrian's Wall. We've been in Carlisle, Birmingham, Blackburn, Preston, Leicester, Nottingham just in the past 2-3 weeks. We've already got 100,000 responses. It is so different. What children are talking about feels really different 6 years on. So look, these are the children who have had the COVID shock, they've had the cost of living shock, we've got the whole social media issue, but what are they saying? Well, just before I started my survey, and I've been triangulating what I found in my polling, we did a YouGov polling of 13 to 17-year-olds. Said, what are your biggest concerns? Cost of living. You didn't hear that 6 years ago. Cost of living, getting a great job, real worries about that. Friendship, no mental health in that top group. War, peace in the world, completely different set of front runners. And I think that tells you something, that children are now, and social media, children are talking to me a lot about being stuck on social media, being unable to get off it, wanting to cut down. So they have become far more sophisticated in their conversations about what makes them happy, what makes them well, what is causing them to be upset. And of course, I've triangulated that by surveying every single head teacher in the country. So I have that data for you on what they think about this. And also we do a mental health, a piece of mental health data on mental health waiting times, prevalence numbers every year. And I've got 6 years of data for that on you. But in children's own voices, it really is just a feeling that somehow childhood just isn't as good anymore. They're wanting to get out and play, not being able to, been stuck on their phones, money been a big issue, parental poverty, parental financial issues been a big problem. So it feels quite different. And that wanting and not being able to get a job. I'll give you 2 children's examples that I think capture this. One, we've been talking to the kids about AI. One little girl up in Carlisle, I want to be an author. But what's the point? Because AI can write the book in 10 minutes. And then another boy, a 16-year-old, saying, I've applied for 200 jobs and all I've got back is an AI response. No person has spoken to me. And I think it's that's actually now impacting our children more than that 2021, we've been locked away coming out of COVID vulnerability. It feels different. So that's what I wanted to share with you today.
Thank you. And so the point of gathering data and understanding things is in order to drive change. So to what extent do you think that the government is adequately listening to that data and understanding the concerns that children are bringing to you as Children's Commissioner? And to what extent have you been successful through that effort in gathering data at driving an appropriate and fit for purpose response to children's mental health from the government?
Okay, so mental health itself, I think one of the best way to answer that is from our specific mental health data. So I do a report every year. I think committee might be shocked to realise that in 2021, when we thought probably mental health issues would be at their peak, we are now 6 years later, it's nearly 1 million children have got an active referral last year. Nearly 1 million children had an active referral to CAMHS. That is double 2021 numbers. So I think, whilst government, I think, has attempted to, and on top of that, when I surveyed every head teacher in the country, what is your number one concern for your local area? We asked them for top 5 concerns for their local areas. We asked them how many professionals they had in their schools, because nobody had that data. Like for the past 20 years, I was a head teacher for 20 years. Nobody knew who you couldn't map who's got a youth worker, who's got a counsellor, who's got a mental health worker, who's got police in the school. Head teachers' number one concern for their local area was mental health support for children. And that was last year. And 90% of head teachers in this country responded to me. And that was their number one concern. So what has government done, and has the response been adequate? So I pushed very hard for the rollout of mental health support teams to try to support schools to be able to intervene early. I think I'm pleased that rollout is now at 52%. I'm pleased that the government has committed to continuing with that. I've got the exact figure. I think there are now 11,800 schools settings benefiting from a mental health support team, up from 10,000 last year. So, that rollout's happening. I'm doubly pleased because most secondary head teachers told me, 82% of secondary head teachers told me, and that's of all our heads, that they had a counsellor. I've always worried about governance I've always worried about where did your counsellor come from? How do you know they've been effective? So the mental health support teams will allow us to do that and should actually cover the far less, a smaller amount of mental health support in primary schools. So the mental health support teams, really, I would get my focus there and get them in there. So I think that's a good thing. CAMS, so, my data over the past 5 years has shown that more money is going into CAMS. So, the government is spending more. But unfortunately, because need has increased at a far greater rate than the expenditure. So unfortunately, it's not adequate. I mean, when I've got I was just looking through at my. So we've got 1 million children with an active referral in our last report. So that's doubled. Nearly a third of those closed without treatment last year, although a slight improvement on previous years. The most common referral, and it fits with what I'm saying, the most common reason for referral is anxiety, followed by neurodevelopmental conditions. They go down the same pathway. And so one of the big things I think we need to do is think about the pathway for diagnosis for NDD, because that same pathway, so that would be something government could and should do. I mean, the most common reason anxiety, followed by NDD. One of the fastest growing reasons is autism. Again, I think, I'm on the prevalence review, and I think the Department for Health really needs to think about what's happened over the past 6 years. We've been diagnosing ADHD, diagnosing autism for longer. The way we do it has changed, and the way diagnoses have given just through practice. And so that prevalence review really does need to think about that and think about the wider impact there on mental health as well. So average waiting times are around a month. About 8% of children wait for over a year for second contact with CAMS. There's huge variation in waiting times across the country. Children in the Isle of Wight and Hampshire are waiting the longest. So they're the two places that have the longest waiting times. And the reports have looked at expenditure at ICB level. Again, a postcode lottery in terms of expenditure per child. So it ranges from £2,500 per child in northwest London to £550 per referred child in Coventry and Warwickshire. So I think that's given you a sense of there is still a postcode lottery, there's increasing demand, more money has been spent. Yeah. Conditions, the way we're diagnosing them and what we're calling them have changed, I think, have sort of stretched at the end, so we need to get that sorted out.
Lovely, thank you. Jen Croft.
Thank you. And just to pick up on something you said about the wider impact of prevalence and the wider impact that's having on mental health. Yeah. Is sort of, in your opinion, is there the prevalence of kind of diagnosis of ASD and ADHD, is that having an impact on people's mental well-being or mental health?
So I think there is such an interesting question, and in the prevalence review we're really looking at those, what's happening at adult level, sort of the underlying population level, where it feels like it's actually staying pretty much the same, whereas you're seeing greater child diagnosis both in ADHD, particularly in autism, and in mental health. There probably is crossover. My anecdotal experience of talking to children and services would say there is, and I think we need to really understand that, and the prevalence review needs to report on that.
Thank you. And we've heard from a few people today how kind of key to reversing some of this trend is early intervention and prevention. Yeah. What does the children's mental health system look like that genuinely prioritises early intervention and prevention, and how far away from that are we?
So, there's a level at which I would hope it would look almost invisible at the early stages. I don't mean that literally, because actually, if we get support for children where they want support, which is in school or in the places that they go to play, how they're experiencing their families and their family life, what they're doing you know, in those, if we get that bit right and we support those professionals to do that bit well, and we pick up with those early mental health support teams on that bit, then we should get the problem solved. You know, we should be able to make a difference there. You know, so many, I've just been asked by the government to do, I've just done 0 to 5 screen time, and I'm doing 5 to 16 screen time guidance at the moment. And, you know, what I'm seeing are parents saying to me, like, you know, I know, and children right across the country saying to me, I know how I feel is impacted by scrolling for 3 hours a night. You know, I know, I give my 2-year-old an iPad and for an hour before bed. Do you think that's going to change their behaviour? And, you know, we know that these, and we're like, so I'm hoping with that screen time guidance, we can help as well by starting to address things like, at what age should you have a mobile phone? You know, should you take these things to bed? It's actually the practical things. When you talk to children across this country, they want to play out, they want to have fun things to do, they want to have friends. The boundaries of school can protect and support them. We can do so much if we actually focus on childhood and get that bit right, and support that well with those early mental health support teams. The CAMHS waiting lists are another thing, right? And some of those issues are a wider issue. But I honestly think a bigger focus on, and that's why I was pleased to do screen time, because often politicians don't want to go there. To talk about, you know, what is a healthy childhood and what should family life look like, could look like. You know, we need to go there, particularly around things like the online world, which I have to say, we might not have all the longitudinal data yet. We've got data showing time matters, but I have to say, in years to come, I think it's going to show there's going to be more than just a correlation between, you know, what we're doing there. Yeah.
And do you have the data that you need to be able to enable a shift looking at prevention and looking at increasing well-being? What would you need if there are gaps in this?
Yeah, so look, I was really pleased to, for example, do the work for the Poverty Commission, because clearly, you know, if we often talk about children's mental health or how many of them are living in poverty, you know, we got all the work from local areas, all the data around additional needs and the support around there, all of that data, and bring it together in my children's plan, which we did last year, which informed the SEND white paper, allowed us to understand all those other determinants of good mental health. I don't think the problem is me having the data. I think the problem is government departments working together and using the data they've got to be able to create a proper joint strategy in education and health to do this right.
And just very briefly before I hand back to the chair, are there currently changes to thresholds and pathways, like real practical changes that need to be made, that would allow children to access support earlier, perhaps without requiring a formal diagnosis? I mean, we've obviously SEND inquiry is wrapped up, but I think one of the things that I hear a lot, certainly, is that people can't access support for ASD or ADHD without a formal diagnosis. Yeah. Does something need to change in that regard?
So, as I said, having both the SEND white paper and the prevalence review at the same time actually gives us a moment to do this. I think we definitely need to get a different pathway for ASD, and particularly for neurodivergence as well. And I think we're basically, the demand is there, and what it's doing is pulling on all the services. I'm slightly worried that the new SEND legislation puts mental health outside of it. That is a worry to me. So we're saying that mental health will not be part of how we do SEND, not because that's the wrong thing to do, but because we have such limited capacity in schools and other places that I'm worried that that's going to impact on children getting the help they need, and it'll become a bit Cinderella. So yeah.
Thank you very much. Caroline Booden.
Thank you, Chair. So you have briefly referred to the disparity in spending geographically from ICBs on mental health, and I'm sure we could all agree that 1% of the ICB spend on children and young people's mental health services doesn't even touch the sides. No. But your report from 23 to 24 talked about using the high-spending ICBs as a benchmark for the additional investment required from other ICBs. Could you just tell us very quickly how this benchmarking approach could be applied in practice and how that would impact the lower spending ICBs?
So I mean, I think, I think what we've done so far is it's almost like naming and shaming or praising. Like, look, we can see who's actually really spending and delivering. I mean, I think that this is something that the Department for Health could grip quite straightforwardly and direct that it be done. One of the things about health is to get things done at the moment, it's almost like a monolith, and it has to come as a direction. And I think we need the ministers to recognise the particular needs of children, and that the impact of spending on children has a lifetime benefit. And so, I think they just need to say that this should be done, and I'm constantly telling them that they should.
And are you noticing different outcomes between North West London and Warwickshire? Is it directly related to the spend?
Yeah, that's such a good question, because it is almost impossible to get any data on outcomes. If you're thinking about our children more well or better, I have tried for 6 years to get some sort of data on the impact of these interventions, and we're still not there. And so I can tell you what waiting times are, I can tell you what spend is, I can tell you what second referrals are, I can tell you that most children last year got referred for crisis. I can tell you all sorts of things. I can tell you about ethnic disparities. What I can't tell you is outcomes, and that's why we need those evaluations.
So we could potentially say that there are fewer children here than here who reach crisis point, which might be an indication that...
Yeah, and we can have a look at that and write to you if you'd like us to. That's very easy for us to do.
Thank you.
Yeah.
Thank you. Mark Souza.
Thank you very much, Chair. You mentioned in a previous answer that children want support in schools. Obviously, education settings are at the forefront of this alongside parents and carers. What should a core offer of mental health and wellbeing support in education settings actually look like?
So, look, I'd like to see a mental health support team, or properly evidence-based trained counsellor and support in every school. But I think it's so much more than that. And I think we don't even have to talk about it, because sometimes it's counterproductive if you set your whole school up to talk about it's just mental health. It's like everything's mental health. Actually, when you start talking about well-being, that can really impact on children far more. We need to think about training for senior leaders and all leaders, so that you get the ethos of the school right, so that they're not putting unnecessary and unimportant pressure on children. I can't tell you how many 14-year-old girls will tell me, I was told, if it was the biggest thing in my life if I didn't pass this exam. It's those simple things like that. We also know the evidence base shows us friendship, for actually having one or two good friends, is the biggest determinant of good mental health later in adult life. So what are we doing about, wider activities at school? Pretty much every child I've met in my last few weeks touring the country has talked about the football club, the games, the chess, the arts, the place where they can be themselves. It's recognising that those things have a massive and positive impact on children's health. Then I'd add, we mustn't ignore those particularly vulnerable children who are also vulnerable for mental health concerns. But it's because of their lives. It's because their parents are poor. It's because they've got problems at home. It's because they're in care. It's because what those vulnerability issues. So making sure, and all the head teachers, 90% of head teachers of this country, when I asked them, would you do more if we could put the professionals around school to support these children? Would you do more? Their answer was a resounding yes. Yeah. They know that is where children need to be met. So we can really, and want to be met, so we can support their well-being and support their family's well-being.
Oh, that's good. I've only got very limited time, so I'll just ask briefly. What role should education providers actually play to support children and young people who are already waiting for specialist mental health support but haven't received it yet?
So the first thing I would say is that they should know who those children are. And this is one of my bugbears. One of the things I found in my survey of head teachers, and I was one, so I love the profession, but I'll call it out when it's not what it should be, particularly in secondary school, heads didn't know necessarily who those children were. And part of being able to do that, I've been a massive proponent of the unique identifier. You know, we really need to get a move on in terms of joined up data, and I don't know why it's going so slow. And it should be, I would say, particularly for this government, the thing they're most ambitious about. If they could get to the end of the 5 years saying, we've done a fantastic unique identifier, health could lead it, they're brilliant, they know what to do. And so children don't have to get lost in the system, and we know who they are and we know when they're waiting, and then heads would know, right, we need to make sure the counsellor's checking in, we need to make sure that the family worker's checking in, do we know the story, and let's get underneath it. Instead, many children are lost. A child whose school does not know that they've just been bereaved by their closest adult has just died, of course they're going to end up needing support and care. You know, and it could get worse, you know, and that is a reality, not so much in our primaries, but in our secondaries. They could not give me the numbers.
Of course. And just one final question, if that's okay, Chair.
Very quickly, please.
You've called for the rollout of mental health support teams to be accelerated ahead of the 2030 target. Is the government ambitious enough?
You know, I think probably the government is ambitious. I think the problem is the NHS, that things just don't go quickly enough. So I think I would challenge the ministers to be pushing the rollout of this as quickly as possible. And we could do more and we could go quicker. So in answer, no.
Thank you. Thank you, Chair.
Can I pick up the unique child identifier point just for a moment? I mean, from where you sit, what are the barriers? You say you don't know, but do you literally have no idea, or do you have a suspicion of what some of those ideas might be and where we might be helpful in unlocking?
So I think it often goes into the too hard pile. It's cross-government, so so that's difficult. I haven't seen enough ambition for it in children's social care. Yeah. I am worried it's more race to the bottom rather than race to, like, why couldn't we...
What do you mean by that, race to the bottom?
Look, if I was thinking of the unique identifier, I would be thinking, let's digitise the Red Book. Let's actually have really good information for parents about mental health. And then sitting behind that, we can share the data. Whereas I think there's a risk aversion sometimes in Westminster, and, you know, particularly in my own department, that's like, oh, what about the data sharing problems? Or what about the going straight to the most difficult case, rather than, hey, we could actually help families, children and parents feel better.
So the single patient record is now part of the bill and is broadly supported. LGA talks about a single person record, which is interesting, although they recognise it's probably a long way away. So are you working with the Department of Health and Social Care as they're developing the single patient record? Because it strikes me that could be the basis for...
We are, and I'm also working with Manchester to set up a prototype in Greater Manchester of a model of how it could work, that could be adopted, how the unique identifier could be adopted. There are bits of examples around the country of people doing it well, but I got fed up waiting. Yep. So we're working with GM, and they're having a go at doing one that could scale up, because everybody on the ground, that knows we need it.
Can you give us some specific examples of data that you're hoping you'll get from it? I mean, you gave us mental health outcomes just a minute ago, which absolutely one, but are there any others that you're champing at the bit to get and you can't?
So, look, my job is particularly focused on vulnerable children and children living away from home. One of the absolutely shocking things that I experienced in my first year in this role was going to a police authority and then giving me a list of children they'd come across as police that were not on any GP's roll, that were not on any school's roll. Then when I started investigating where the children who were not at school were, one of the things I did was use my data powers to find out how local authorities, how many children have you got in your area, and do you know where they are? Unfortunately, they didn't. It wasn't... They knew most, but there were too many at the edges, anomalies. And I think part of the... So for me, it's a basic safety need. I'd love to see, and this one's contentious, but I worry very much about children whose parents have gone to prison, who are left at home. And there must be a way of using a unique identifier to support them that is supportive.
The charity Seen Not Heard is in my constituency. I've spoken to them many times about this. No, you're absolutely
right. And we could go on. We could go on. But I also think there's another side, which is this could really help if we like I say, digitise the red book as the front, but you could be giving your screen time advice to families, to mums there. You could be seeing dental appointments there. I mean, one thing I ran the Attendance Alliance in Manchester for a few years in this role to see if I brought all agencies together, under the mayoral thing, could we actually move attendance? And I had dentists, nurses, doctors, DCSers, head teachers, everyone around the table. They were great. Everybody got involved. We moved and improved attendance. But what was remarkable was people saying, God, I had no idea attendance figures were that bad. I'll stop doing appointments like that. We'll go do support in schools instead. It's that place-based talking to each other. But if we can't model it in Westminster, how on earth are we going to model it in local areas? We've got to do better.
No, I think the point you raised is what I wanted to come on to next. In our severe and moderate mental ill health inquiry, we heard very strong evidence that co-creation is how you create something that actually works for the people it's meant to be helping. And I will ask the committee for their patience, but this is so moving. We had a strategy day in Abingdon where youth came together with civic leaders, with businesses, and they wrote us a letter. And it's a letter for the future. I'll just take a small excerpt. But they talk about how young people today are growing up feeling isolated, angry, anxious, unheard, lost. They feel there's nowhere to go, nothing to do, and no one really fighting for them. When support disappears, problems don't disappear with it. But they go on to say that they want today, that was Friday, to not be another meeting. They want a commitment from us to hear their voices, a commitment to work together, a commitment to create a strategy that actually reflects the reality of young people in their community today, not assumptions, not statistics alone, but our real lives. It was genuinely heartbreaking in the room, but really inspiring. And what I got from the day was they know what to do. And they were bossing the businesses and the councillors and everyone else in that room was listening to what they were saying, and they were coming up with the answers themselves, and then the adults sort of just helped to make it work. What scope is there for that in this? Do you feel that co-creation with children is possible? And how can we do it in a way that's embedded in the forthcoming mental health strategy?
Yeah, look, it's music to my ears. I have 20 ambassadors, and normally I wouldn't get who've all applied for the role with all sorts of different backgrounds, and normally I wouldn't meet a minister unless I had one of them with me. Only 1 in 5 children from our surveys think that those in power listen to them. We've got to change that. And they absolutely would add ideas, innovation, commitment, sharing, good comms. They're brilliant. So of course we should. Nothing
embed it. What needs to change in the system, rather than it being a nice to have, or even worse, it's a tick box, and don't they? They're here as a sort of a badge, but actually they're not involved in the funding decisions. They're often not involved in the final outcomes and the reevaluations. How do we embed them into the system?
Yeah, so most, whether you're talking about a local authority or an institution, most have their kind of student voice things, but those groups can feel. So I think it's governance. So I talk to young people a lot about be the youth governor on the proper board. It's, I think there's all sorts of things we can do to make that happen. And also here, no law about them unless we've at least taken their views and had a look at it and thought about it. So there are lots and lots of ways, and there are lots of ways we do it in terms of what we put forward to you all. But the voice is clear, and things are better about children if children have been properly consulted, listened to, and helped shape the outcomes.
So to the strategy specifically, what do you want to see in it that will concretely make a difference? You've spoken in the past about sort of a joint framework of accountability between Department for Education and DHSE. That's very similar to lines that our committee in the past has, suggested, Section 75 arrangements, funding arrangements between local authorities and National Health Service work better? What concrete, specific policies should we be pushing to make something like that possible?
I mean, the first thing I always say is a joint outcomes framework. We need to be working towards the same thing, and that should be right across the public sector anyway. So I think there's that. I think there's a recognition. I mean, somehow we have to get the absolutely most fruitful thing. If we have so I want a children's strand, a strand about children that involves both health and education, where decisions are made together with both sectors that actually runs through that. You cannot get two different things, health to education, right? So education is completely diverse. It took a survey by me to find out where professionals are and what nobody knew where what was going on in schools. It's so diverse, whereas health has been a monolith. But I actually think if those two things if we can bring them together, I think we can actually start trying to build both that joint outcomes framework, but actually pick the things that will work. I definitely want a different diagnosis pathway for NDD. I think it's totally wrong just to put the NDD and mental health in together. If there was one thing, I think that would be it.
Okay, that was going to be my very last question. So that's the thing that you think would be hugely important.
Yeah, that's the specific thing. Yeah. I mean, I think we were talking about local areas, weren't we? And we were talking about the unique identifier. I think with that family hub rollout, there you start. Well, if we can get local place-based ways of this strategy working through, it's got a chance with a decent outcomes framework.
Lovely. Thank you so much for your time today. Thank you, both committees. Order.